Hello, I'm Dr. Louise Newson. I'm a GP and menopause specialist working in Stratford-upon-Avon, and I'm recording this today to talk about vaginal dryness, which is a very common symptom, yet really not spoken about. It's spoken about less than the menopause, and the menopause isn't spoken about much. So before I get started, I just wanted to let you know that I'm not sponsored by anyone, I'm not funded by pharma, I'm not paid to promote any products. So what I want to do is share with you some evidence-based, non-biased information to hopefully educate you and help you so you receive the right knowledge, and also then you can ask for the right treatment to really help. So when we talk about vaginal dryness, it's actually a lot more than that. The vagina is only one part that's affected, and not everyone gets dryness. So why we call it vaginal dryness is a bit weird. There are other terms for it. Some doctors refer to it as vulvovaginal atrophy. And if we look at the anatomical structures between our legs, we have a vagina, which is the tube leading to our womb. At the top of the vagina is the cervix, the neck of the womb. But also we have in front of the vagina, we have our urethra, which is the tube that we wee out of. And obviously behind we have our anus, which is where we poo out of. And estrogen is very important all around these tissues and structures, and estrogen is the main hormone that we produce before the perimenopause and menopause. And during the perimenopause, the estrogen levels decline, and after the menopause, the levels are very low of estrogen, and they remain low unless a woman takes HRT. And because the levels are very low, then it can affect the tissues because the cells respond to estrogen. So the vagina is the inside bit that we don't really see, and then externally is the vulva. We have labia majora and minora, and then the vulva, which is essentially the area that is seen if you hold a mirror or your partner sees between your legs. And these cells in the vulva and this area also respond to estrogen, as well as the urethra. And so if you know that, then you'll know that low levels of estrogen that occur locally can cause other symptoms in these areas. So it's not just the vagina that becomes affected by the low estrogen levels, the vulva does, the urethra does, and also we have cells that respond to estrogen in our bladders and our pelvic floor, which is the big sling of muscles that support the vagina. So all these areas are affected. Now, if you think about how important estrogen is, and then without it, how many symptoms can occur, it's very important to reflect and think. And so it's not just dryness. A lot of women experience symptoms such as irritation, itchiness, discomfort, burning, just difficulty sitting down, hard to wear underclothes because it can cause a lot of irritation. Some people don't have any vaginal or vulval symptoms, but they have urinary symptoms. So they find they're going to the toilet more frequently, more often. Sometimes they have some leakage, some incontinence. Sometimes it can be when they cough and sneeze. Sometimes it can be because they can't get to the toilet in time, or they're getting up at night more often, or they're having recurrent urinary tract infections. Some people actually find that they get a watery discharge, so it's not dry, they get some discharge. Some people think they have recurrent thrush. So there's all sorts of symptoms that can occur, and it's all related to this low estrogen that occurs around these areas. Now, some doctors call it genitourinary syndrome of the menopause, or GSM for short, and this encompasses the urinary symptoms as well as what happens in the genital tract. But it's quite a mouthful, and a lot of doctors still aren't used to that term. But for me, thinking it used to only occur in younger women is completely wrong, because as soon as estrogen starts declining, people can experience symptoms. And so symptoms can sometimes be one of the first symptoms of the perimenopause or menopause. People find that they have itching or irritation or recurrent urinary tract infections. Other people find that they've gone through the menopause and their symptoms such as flushes and sweats have disappeared, and then they develop recurrent urine infections or incontinence or vaginal irritation, itchiness, soreness, and so they don't always put it in context and realise that it can be related to the hormones because their menopause was so long ago. So we're all very different, and our experience of the perimenopause and menopause can be very different. So if you are experiencing any of these symptoms, then it is quite likely that you may be having some vaginal dryness or GSM, and it's very important to have the right diagnosis and then receive the right treatment. So how do we make the diagnosis? Well, actually, a lot of people can have the diagnosis made by just talking about their symptoms and asking the right questions from the healthcare professional. So if I see a lady who is in her, say, for example, mid-40s or mid-50s or mid-60s or older and has symptoms, then I'll often ask, are you having any irritation? Are you having any itchiness? Are you finding it uncomfortable? Sometimes it can burn or sting to pass urine. Are you waking in the night and passing urine? Have you had urinary tract infections in the past? Are you finding that it's uncomfortable to have sexual intercourse or penetrative sex? And all these questions will lead me to think about whether the symptoms are due to vaginal dryness or GSM. And there are other reasons why people can have these symptoms which clearly can't be ignored, and it's important as a doctor that I make a proper diagnosis. Sometimes it can be difficult though, and if a woman notices there have been changes in the appearance of the vulval area, then it can be easier to know if there's something else going on. And a lot of women don't examine their vulva or hold a mirror up, so then women need to be examined if there's something they're concerned about or if they have symptoms such as bleeding. But for a lot of women, the symptoms are associated with menopause, and their history, their story that they tell the doctors is enough to make a diagnosis. And often we give treatment without examining a woman, but if her symptoms persist without improving despite having treatment, then that's the time that women need to be examined, because there are some conditions such as a dermatitis, inflammation of the skin in the area. There's a condition such as lichen planus and lichen sclerosis, which can cause changes in the appearance which don't always improve with the treatments that we give for vaginal dryness. And then more rarely, less commonly, women can have vaginal and vulval cancers as well. And so clearly it's important that if you have any symptoms that aren't improving or any symptoms you're worried about, then you must see a healthcare professional to be examined. But if you have any of these symptoms that I've just mentioned, then you can start treatment quite safely. And there are some treatments you can start without even seeing a healthcare professional. So some of the treatments you can buy either online or from a chemist, or sometimes you can get them on prescription, but it means you can start trying to help yourself. Before we think about treatments though, we need to think about hygiene. And so it's very important to think about, what are you using in your daily routine when you wash? Are you using a scented product or a soap or a douche? Because you shouldn't be. And a lot of women are quite horrified to think that, especially because clearly we all want to be clean and we put soap on our bodies, we wash our hair. So a lot of people are putting products down below on their vulva, even in their vagina, which they shouldn't be. So anything that is marketed as feminine hygiene products, you should be avoiding. And partly they're expensive, you don't want to waste your money, but they can cause more irritation. So for example, if I had a rash on my arm and I put a scented product on it, it will cause a lot of burning, smarting, discomfort. So we shouldn't be using anything that's scented in any way. And some of these products, the pH, so the acidity, isn't in keeping with the natural pH of our bodies, and so that will cause worsening of symptoms often. And so I always say to women, do we wash our mouths out with soap? No, of course we don't. And we have more bugs in our mouths than we do in our vaginas. We have bugs in our vaginas, and sometimes the overgrowth can change because the pH changes, but we don't need to use a product in our vaginas or on our vulvas. It's a self-cleaning area, the same as our mouths are. So we can use water. Some people who have some irritation use an emollient, such as Cetraban or sometimes Dermal, and there are lots of others that you can buy or that you can have on prescription. And although they're an emollient, they can be used with water to clean the area. And so that can be very useful if you're having any irritation. But you don't need to use anything else. Even some panty liners can be scented, and they can cause more irritation as well. So anything that smells nice, do not use down in that area. And then it's looking at your underclothes. So wearing a nylon thong is probably not the best if you have these symptoms. You should be wearing cotton, natural fibres, sometimes loose fitting garments can be better. A lot of women tell me that they have more irritation when they wear trousers or when they wear jeans or certainly tight fitting garments. So changing what you wear until the treatment starts to work can be very beneficial. So these are very simple measures that are often very effective. And then we need to look at treatments that we can use topically, which means around the vulva, the vaginal area. And then there are some systemic treatments which you can use generally. So I'm going to start talking about local treatments, and I'm going to start talking about non-hormonal treatments. So these are treatments that have no hormones in, that every woman can use very safely. So when we look at the area, we need to try and have more moisture into the cells. And what happens with vaginal dryness is the lining of the vagina is made to be stretchy, so that it can be expand easily, obviously during intercourse. But when women walk, then it should be stretchy as well, and the lining should be quite plump. There's a good blood supply to it, but without the estrogen, all this becomes very thin. It becomes inelastic, and so you can imagine, just for a lot of women, even walking can be uncomfortable. Sitting down, and a lot of women find they can't exercise, they can't ride a bike, can't even put on a swimming costume because it's so uncomfortable. And so we by providing some moisture to those areas and to the cells, this can really make a difference. So the non-hormonal moisturizers can help draw moisture into the cells lining the vagina, and if you like, plump it up or plump those cells up, so then the lining of the vagina becomes thicker, more lubricated, and can really help some of those symptoms. There are a huge number of these symptoms available over the market. Some of them are fantastic and some of them are not, because they contain chemicals, they can contain perfumes, some of them are the wrong acidity, so they can irritate. So you have to be, again, very careful. And we also know what suits one woman might not suit another. It's a bit like the moisturizers we use on our skin. What I find useful, somebody else might find not useful. Who knows? So it's important to go with the ones that are recommended really in the first line. So I've got some here to show you. There's a great company called Yes, and they are an organic company, so their products are organic, and they have they have a moisturizer which is called, this is the box for it, it's called Yes VM, which stands for Vaginal Moisturizer, and it comes in a tube, and it can be used externally and internally, and a lot of women find this very useful. There are a couple of others that we recommend, and in my clinic we have lots of samples to give to women. This one is called Regel, and this comes as a single use, and it can be used every 2 or 3 days, and the contents just inserted in the vagina. Some people put it on their finger and use externally, but that can be very useful as well. And then Silk is another one. SYLK is an intimate moisturiser that comes with an applicator, or you can put it on your finger. And those three are the ones that I've found over the past few years, the ones that women like the best and have the best results with. You also have to look at the osmolality and pH of these products, because if they're wrong, it can draw moisture away from the cells and make it worse and cause more irritation. So it's worth trying these. Sometimes people find they're very uncomfortable using initially, and then that does settle down. So try and persevere, certainly for the first few weeks, until you find that hopefully the moisture gets drawn into the cells and you'll start to feel a bit better. Obviously, pain during intercourse can be very common, and the moisturisers might not do enough. So yes, I've got two products that are lubricants. There's an oil-based one and a water-based one, and these can be used. Often it's a personal preference whether you want to use the oil or water-based. You can use oil and water-based together. So there's lots of information on the Yes website about these products, and so it's worth looking at a good quality lubricant and a moisturiser, but the moisturisers have to be used regularly. It's a bit like moisturising our face. We do it once or often twice a day, and it's the same with these moisturisers. They have to be used regularly. And like I say, every woman can use the moisturisers regularly. These non-hormonal moisturisers and lubricants are safe for every woman. But for some women, it's not enough, these treatments, and they're not treating the underlying cause. As you know, the underlying cause is due to low estrogen and sometimes also low testosterone levels in the surrounding tissue and the vagina. So it's important to consider ways of replacing that estrogen, because then you're treating the underlying cause. So the commonest way that we do this is using localized estrogen. So localized just means in the vagina. And this is very different to HRT. It is still estrogen, it's still a hormone, but the dose is very, very low. One of the ways that we use a lot is something called Vagifem, which you might have heard of before. So this is Vagifem. It comes as a blue plastic stick. And if I open one, I can show you what it looks like. So it comes with a little plunger, so that this little bit is inserted in the vagina and then it's plunged. And if I press the plunger, this little tablet pops out. It's a very small tablet, and it's like a sort of slow release almost. It goes into the vagina and the surrounding tissues. So it will go into some of the urinary tract as well, so the urethra, which sits just in front of the vagina. It's a very low dose, so it's only 10 micrograms. The lowest dose of a tablet HRT is 1 milligram, so that's 100 times more. So this is 1/100th of the smallest tablet dose of HRT. Now, this is used, we recommend that it's given every day. You insert it every day. Often people insert it in the evening for 2 weeks, and then twice a week after that. So if a woman is using it twice a week, so there's 52 weeks in a year, she might forget the odd one. So if we say 50 weeks in the year, then using one of these for 50 weeks means that the overall dose is 1 milligram, which, as I've said, is the lowest dose of a tablet HRT. But we're not using this orally, we're using it vaginally. And because it's worked vaginally, then it doesn't get absorbed into the rest of the body. The first couple of days it might, because you can imagine the lining of the vagina is very thin. So it's very easy then for any hormone to seep out, if you like. But because the estrogen works to build the collagen, to help with the blood supply, to build the wall, to thicken the cells, then it doesn't get absorbed after a few days. In fact, the studies have shown it's the same as placebo. And so this is very important to know, because the estrogen that is used vaginally doesn't get absorbed to the rest of the body. It's not the same as HRT, but it also means that women who've had an estrogen receptor positive breast cancer can still safely use vaginal estrogen. And a lot of doctors don't realise that, a lot of patients don't realise that, a lot of women don't realise that. But the guidelines are clear and the evidence is very much there that we can use vaginal estrogen in women even if they've had an estrogen receptor positive breast cancer or another type of cancer that is estrogen receptor positive, because the dose is low and the absorption into the body is not there. So that should be really reassuring to a lot of you. So this is Vagifem, which is this little tablet. Now there's other preparations as well. There's one here that I'll show you which is really useful called the E-string, and it's impregnated with some estrogen, and it's a slow release, so it lasts in the body for 3 months. You can see it's very squidgy, and it's quite small. It looks a bit dramatic when you see it as a ring, but actually when it's squashed, it's just really like a tampon that gets inserted into the vagina. Sometimes healthcare professionals insert them, but a lot of women find they can do them themselves. They might find that they need to use some vaginal moisturiser on top just to make it a little bit more slippery so that it inserts. But once it's gone in, it then just opens up as the ring and just really rests under the cervix, the neck of the womb. It can't go wrong, it can't get lost. If a woman inserts it and finds it uncomfortable, then she can just put her finger in at the edge and pull it out and try again. A lot of women keep them in all the time. Some people take them out for intercourse and then reinsert them, but other people keep them in because they don't interfere. So it's a personal choice. But these can be very useful, especially for women maybe who don't have good manual dexterity, or they don't want to be inserting something in their vagina on a regular basis. When I was a GP, I used them a lot for women who had dementia, who were finding it very difficult and having lots of urinary symptoms, and using the estering really helped. So they just need to be changed 4 times a year. So this is one option. And then there is a cream. Well, there's 2 types of estrogen cream that we can use. One of them we use commonly is called Ovestin. And this is very good externally. It does come with an applicator, so it can be used internally. But a lot of women find that the Vagifem, for example, works internally, but they still have some external symptoms around on their vulval area. So the cream can be used as well, and it can be just applied with the fingers. Some healthcare professionals are very nervous about using the Vagifem with the cream, but actually it's very safe indeed. So you can use both together. You don't need to have any extra treatment to protect the lining of the womb, for example. The doses are very, very low, so you can be reassured that you can use different types of topical treatments together. Some people find this dose of the Vagifem twice a week isn't enough, so some people use it 3 or 4 times a week, and that's absolutely fine as well because the individual dose is so low. There are some other products that have come to the market. There's Invagis, which is a pessary of an estrogen, and then there's also Blissel, which is a gel, which some people find good. And then more recently, this has become to the market in the UK called Intra Rosa. The other name for it is Prasterone, and it's a pessary, and it contains something called DHEA, which is a precursor for 2 hormones, for estrogen and testosterone. And because we have testosterone receptors in cells lining our vaginas, it can activate those as well. So some people find if Vagifem hasn't helped, then using the Intra Rosa helps in a better way. So it might be something that people can consider. It's used once a day rather than the twice a week that I've mentioned with the Vagifem. So there's always options, and these localized hormones can be used with the non-hormonal moisturizers as well, and often people find a combination really useful. But some people find that's not enough for their symptoms. But I've already said that women can experience symptoms related to vaginal dryness during the perimenopause, menopause as well. And so, as you know, a lot of women experience menopausal symptoms such as hot flushes, night sweats, brain fog, poor memory, reduced concentration, anxiety, low mood, migraines, headaches, joint pains, muscle stiffness. The list goes on because estrogen affects us all over our bodies. So if you are experiencing other symptoms in conjunction with vaginal symptoms or urinary symptoms, then you need to think, would having systemic hormones help? And we know from the evidence that HRT provides more benefits than risks. And so this means that if a woman has the right dose and type of HRT, then it can improve symptoms, but also, more importantly for me, I suppose, as a doctor, is that it can reduce our future risk of conditions such as heart disease, osteoporosis, diabetes, dementia, really important diseases that are often neglected as we get older. So there are very few people who can't take HRT in the first line. Clearly, if someone's had an estrogen receptor positive cancer in the past, we wouldn't give it HRT in the first line, but sometimes it's still offered under specialist guidance. But for most women, then we can use HRT. And when we're looking at symptoms related to vaginal dryness and urinary symptoms, then actually we can get higher doses of estrogen in the local tissues. And so some women find that having HRT really makes a difference when perhaps the localized estrogen treatments haven't been enough. There are also a lot of women who start taking HRT and have no localized symptoms, but then with time they're having recurrent urine infections, they're having painful sex, they're having some irritation, some discomfort, maybe even some discharge, and this can be all related to not having enough estrogen in the vagina or the urinary tract. And so we know around about a fifth of women who take HRT can need to have localized estrogen, and it's very safe to have both. So on our annual review, for example, of patients, I always ask, are you having any symptoms related to vaginal dryness? And if the answer is yes, then I prescribe the pessaries or the ring or the other treatments that I've mentioned as well, the hormone treatments, and that's very safe. We don't need to have any other precautions. The other thing that's very important to know is that any treatment we give for women who have symptoms related to vaginal dryness have to be had in the long term. And the reason being is that we're replacing the hormones, we're replacing the estrogen locally. As soon as we stop, then the symptoms will return. And so you can imagine the lining of the vagina becomes thicker, it becomes more vascular, there's more blood flowing through it, it becomes more lubricated. But as soon as that treatment stops, then it will go back to how it was before. So a lot of people find symptoms, for example, such as flushes and sweats, will improve with time. Sometimes that time can be many years, but they will improve with time. But unfortunately, symptoms related to vaginal dryness will not improve with time, so you can't neglect them. We know from studies that around 80%, so 8 out of 10 women who are postmenopausal will experience symptoms related to vaginal dryness. Yet we also know, really sadly, that only about 7% of women receive treatment. So that means there's a huge number of women out there who are suffering needlessly because they're not having the right treatment, and that's sometimes because the doctor or healthcare professional doesn't know what treatment, and often it's also because the woman's too embarrassed or thinks it's too trivial to talk about, and a lot of people don't join the dots. And certainly I know myself as a GP in the past would see so many women who had recurrent urinary tract infections, and I wouldn't think about estrogen. I wouldn't think about giving them local estrogen to improve their urinary symptoms, because if you don't know enough about it, you think, well, the vagina, what's that got to do with the urinary system? Well, actually, putting the localized vaginal treatment, such as the pessary, into the vagina will seep through and help the urethra, the tube lining, draining the bladder, and even the bladder as well. And these cells respond to the estrogen, and it means that any bugs are less likely to stick and then become an overwhelming infection. So using local estrogen can really, really improve urinary symptoms and also urinary tract infections. So if you are one of these women that gets these symptoms, you should be considering some localized estrogen, and possibly HRT as well, but certainly localized estrogen. Some women think that they've left it too late and they're too old to start treatment, and no one is too old. And certainly any woman of any age can have localized estrogen, But even starting HRT, sometimes we start people in their 60s or 70s. I started someone recently who's 80 on her HRT that she'd stopped 20 years ago when she reached 60, and she was incorrectly told she had to stop because she was 60, and she was really experiencing symptoms. So I gave her a low dose of estrogen, and giving estrogen through the skin as a patch or gel is the safest way of having estrogen if they've still got their womb. And this lady had a hysterectomy in the past, so she didn't need it. But if a woman's still got her womb, then she should have a progesterone. Either the micronized progesterone or the Mirena coil can be a good option. So it's very important that women receive individualized advice. So just to recap, they can have localized non-hormonal treatments such as moisturizers, making sure it's the right ones, and then they can have localized estrogen, so such as estrogen as a pessary or this ring, or there's the gel as well, and a cream. So this is very different to HRT. They're in the warning with a patient information leaflet in the packaging. We'll talk about risks such as risks with systemic hormones which are outdated and incorrect, so you can just ignore them and feel reassured that even women who've had cancer in the past can still safely use the localized hormones. And then for many women, taking HRT is a good option, but women will need, like I say, around 1/5 of women will need to use localized estrogen as well as systemic HRT. So there's lots and lots of options. I also wanted to mention about urinary symptoms, because the treatments that I've mentioned might not be enough to improve symptoms of urinary frequency, incontinence, urge incontinence, stress incontinence. And so a lot of people find that their pelvic floor doesn't work strong enough or well enough. And so pelvic floor exercises can be very beneficial. And there are some other specialized treatments. So if you are suffering with any urinary symptoms, then you should ask your doctor to be referred to a pelvic floor physiotherapist or a healthcare professional with a special interest in the pelvic floor. Some of you might be interested in this book, which is written by Jane Simpson, who's a continence specialist, and it's called The Pelvic Floor Bible. It's published by Penguin, and it has lots of really good information for women and also for men about the pelvic floor and treatments and ways of improving our bladder function as well. So that's well worth a look. Talking about another book, actually, some of you might know the very inspirational Jane Lewis, who she's not a medical practitioner, but she is a lady who really suffered with vaginal dryness, and it occurred early on in her perimenopause. She had no idea what was happening. No one had told her it could be related to her hormones, and she had such severe symptoms that she at times felt or thought about taking her own life, because they were so debilitating and really having a negative effect on her ability to function. So she's written this book called Me and My Menopausal Vagina. It's available on Amazon, and it's beautifully written. It's very simply written, very informative, and very open and candid about her own experience and about ways of receiving good help. And she has a closed Facebook group, a hidden Facebook group that women can access to really be given some support and also some very general tips and advice that a lot of my patients certainly have found very interesting and really useful. So it's worth connecting with her if you're struggling. Also, there's my book, the Menopause Guide by Haynes, which is also available on on Amazon. And this has got some really good tips about the menopause in general, clearly, but also about vaginal dryness and urinary symptoms, because they are so common, and I can't reiterate enough that they will not go away on their own. So if you are experiencing any symptoms, then you must get in touch with a healthcare professional. It might be your doctor, it might be a nurse, it might be the pharmacist, it might be a menopause specialist, and it might be a combination of healthcare professionals until you receive the right help that is right for you. And that's where it's important. You know, we're all individuals, we all have different experiences, different symptoms, different healthcare beliefs, and so it's very important that whatever you use, you feel comfortable with. It can sometimes take a few months to have the benefit from any treatment, so you've got to persevere and use it regularly. But if your symptoms don't improve, or they improve a little but you're still experiencing symptoms, then you must go back, because there are options, there are choices, and often women need a combination of treatments. There's more information also on my website, and I have done podcasts. I've recorded podcasts with Jane Lewis and Jane Simpson, the two people that I've mentioned, so they will be able to give more information, and you'll get more information by listening to the podcast as well. There's also a little, it's only a little 2-page fact sheet on my website. If you go to menopausedoctor.co.uk, look under resources and leaflets, and you'll see this one, which is called Vaginal Dryness, and you might find that quite informative as well. Some people are just downloading it and showing to their doctors, which is going to help that initial conversation to get the right treatment. But I hope this short video has just shown you that there are lots of good treatments out there, and so no one should be suffering. You really shouldn't. And we know the earlier that you receive treatment, the better, because it's more likely to really improve. But any treatment that you have that works, you need to persist with and take in the long term. So don't give up too soon, don't stop the treatment, and make sure that you receive the right help. So I hope that's really helped you today, and make sure that you feel better and receive the right help. Thank you.